Hey there, my name is David West, and I'm an enterprise agile coach, and I'm also a gamer. This is my story of healing, and I want to send this out to gamers who are suffering from chronic pain, hard to treat neck pain things, thoracic outlet syndrome, compartment syndrome of the forearm, carpal tunnel syndrome, and just kind of any sort of chronic pain condition. If you're suffering from brain fog, chronic fatigue, fibromyalgia, anxiety, depression, panic attacks, thoughts of suicide, this is all for you. And it's to inspire those who are in chronic pain of any kind never to give up, and to possibly take a look at this advanced treatment by an award-winning celebrity doctor and the new self-help tool that he invented and I discovered along my journey of healing from my severe chronic pain conditions. So my story starts back in 2020 during the pandemic, and I ended up having to work from home, as many of us did, for my job, and it is a very computer-focused job. You know, I am on the computer all the time, so they sent me home with this little laptop. Normally, I have this nice sit-stand desk with a bunch of monitors that I can adjust however I want. But during the pandemic, I was kind of crunched down into this large frame of mine was kind of had to be compressed down, looking at this tiny screen. And when I wasn't doing that, I was probably on my phone, scrolling through, holding this in all sorts of awkward positions, or I was, since I am a avid gamer and have been since I was little, I did a ton of gaming because we didn't have many other options back then. So for most of 2020, that was the stuff that I was doing. Then comes 2021, and early in that year, I started developing, almost completely out of nowhere, numbness, tingling. My hands were falling asleep. I just kind of woke up one day and one of my hands was just totally dead, and I had to shake it out for a really long time to get it back up. And all of a sudden I started getting severe pain in my forearms, and it would hurt really bad. There were times where I would say I would describe it as it felt like somebody coated napalm in the muscles of my forearms. It would just burn. It wasn't going away, and in fact, it was getting worse. I started going to see several different specialists. I went to go see my usual family medical doctor, saw a couple of chiropractors, a physical therapist, and 2 different massage therapists. So, I got some medical advice. The initial advice that I got, I was told I was probably doing too much of the gaming, too much computer work, and I was told probably I'd developed something called tendinitis, and that I should rest it and ice it. And so I got a couple of those braces, for the carpal tunnel kind of stuff, and I would put ice on it, and I rested for a week straight. I did nothing, right? And the pain did go away, and then I resumed normal activities again, and it didn't take even 24 hours. The pain came back even worse than it ever was before. And so I decided, okay, that's not working. So I had some relatives who got help from a physical therapist for some pain that they had. So I went to a physical therapist, and he gave me some stretches to do. He gave me some strengthening exercises with these kind of rubber band stretching things. And that did not do a whole lot. So I decided, doing some research about, trigger points and compressed muscles and all that I might go see a massage therapist. So I went to go see one massage therapist, and he really did his best, but it didn't really help a whole lot. So I ended up finding a different one who did help make the pain go away. And that was kind of the thing I was finding, was the pain would go away for a little bit. Maybe if I had a really good session, it would take, 24 or 48 hours. I would feel a little bit better, but then it would creep back in. And, I might go to bed after having this massage, wake up the next morning still in pain. So went around and did some more research, and I found a chiropractor And he did some adjustments, he did some manual therapy, trigger point therapy, that kind of thing. And I did start to see some improvement, but that took a really long time for the improvement to set in. Like, I saw him for like 8 months, and it slowly but surely, some of the stuff got better. Some stuff, like the tingling, kind of increased a bit. But, if I would be holding a game controller, being on the PC, playing a game, or working on my laptop, pain was always kind of start to creep back in. And so, I am relatively young, and I knew this is not normal, and some of the advice that I was getting didn't make sense to me about, this just happens when you're a certain age and all that. And I didn't feel like I was getting to see answers. My second massage therapist was really helpful for me. He was very knowledgeable. He really knew his stuff about inflammation and trigger points, and he really was instrumental in pointing me in some of the right directions. But again, like, his stuff, he's so good, unfortunately, that he is very hard to book. So I had a hard time, getting him on a consistent basis. So, I also tried some self-help tools. I tried foam rolling, I tried lacrosse balls, that did a little bit, but it's like you're kind of pushing down into the muscle, and that's not great. And I tried massage guns. So the massage guns, it would hurt quite a bit after I used them, and I would actually end up like with bruises on my forearm if I was like really going after it. And because it's like, it's like a hard plastic, and it's like slamming into your forearm. And now that I have learned more, I know they don't really do a whole lot for your circulation either. And it was kind of hard to maneuver. You're holding a gun on it, and you're in a weird angle. One of your wrists is getting all kind of goofy while you're doing that. So one of the things, though, that kind of came out of this was my massage therapist, who I ended up sticking with. He actually had me do like a test up in here, and he said, I think you have something called thoracic outlet syndrome, which I had never heard of before. So I did my research and found that it is extremely hard to get rid of. And there were all sorts of different advice, out there on how to do it and stuff. Unfortunately, a lot of doctors out there who do treat it go for a surgical option, which is where they will cut muscle out of the side of the neck and also remove the first rib, which actually my massage therapist said, my massage therapist used to be a ER nurse. So he was able to say, I highly recommend you don't touch that. Don't do that. That is a complete waste, and I don't even understand why they do it. My own research led me to kind of agree with what he said, is that many of the people who get this thoracic outlet syndrome surgery get worse. And there is no putting the rib back in once that's done. It's gone. And you can't start over. So I was going to find a way to get rid of this without resorting to surgery. In November of 2022, after a year of dealing with the chronic pain and the numbness and seeing, only a little bit of improvement, it's like I knew, come on, this has been long enough. There is a way out of this. I know it. So, and I think I have come across some really great things in that time. And one of the big things that I found was the leading expert in the world on thoracic outlet syndrome without surgery. And that is kind of how I roll. I want to find who is the expert, who are the people out there who know their stuff. And that's where I found Dr. James Stockson, who is headquartered out of Chicago. I happen to live in Illinois, so it was kind of a no-brainer to look into him. So I got his book as an ebook, and I wanted to read that first. And I read through it, and everything made sense to me. And he talked about in his book how he had thoracic outlet syndrome 30 years ago, and he beat it by treating himself. And he beat it, and he has been, since then, reversing hundreds of cases of TOS, thoracic outlet syndrome, without surgery. And his book is called The Human Spring Approach to Thoracic Outlet Syndrome, and that's kind of where he outlined how to deal with it, and then I was able to understand it. He's given keynote presentations or 10 or 20 medical conferences on thoracic outlet syndrome, and now he pretty much only treats severe cases of thoracic outlet syndrome and other severe upper body problems. So I called his office, Team Doctors, in downtown Chicago, and it was only a couple hours away by train, so he was able to get me in for an exam, and we booked up, and I went in. The examination took a couple hours, and he did, I will say that, I'd seen so many different people at this point, and Dr. Stockson did the most comprehensive test on me that any of them did. Any of them, by far. He went over every muscle that was related to thoracic outlet syndrome, and he did muscle tests, orthopedic tests, and he went over everything in there. But when he got done, he was able to tell me exactly what was wrong. I could feel all of the ropey, tight muscles that he was feeling, and he explained to me what they meant and how they were related to my syndrome. And he said, I had a severe case of thoracic outlet syndrome, bilateral, which means it was on the right more severely, and on the left it was more moderate. And then this one really was kind of an eye-opener. He said that I had something called compartment syndrome of the forearms bilaterally, so in both of the forearms. We knew that this was a case because when you say like you got a thumb and you pushed it into the forearm, there's something called a pitting edema, which was like a pit indentation, and it wouldn't go away. It just stuck in there. It's like putting your thumb into clay, how clay just kind of stays down there, and it wasn't going back up like your skin really should. And again, I found that there were very few doctors talking about compartment syndrome that didn't involve removing parts of your body, which again I was not going to deal with. And the images of what the surgery looks like, and again, there's no way to go to be, it's very much like the thoracic outlet syndrome surgery. If there's no going back. There is no going back once you get that done. So again, I didn't want to do any sort of permanent life-altering things if there was another way. And I found out that there were cases which it would cut off the blood flow from the forearm wrist and cause cells to die, and you might end up having to have like fingers amputated because your body is not flowing blood properly to your hands. Which that was something I was starting to experience, was my hands going cold, and that all kind of made sense. And the compartment syndrome, very much had built up over the years, especially I think during the pandemic, where I was in such a bad ergonomic position and constantly overusing the forearms. And with the blood restricted at both the thoracic outlet and also at the forearm, it was what's called a double crush, which means the blood flow was just very little going into my hands, and that was not good. So after the examination, Dr. Stockson realized that I was stressed out and that I was in a lot of pain, and he did about an hour of therapy treatment on this tool that he invented called the Vibmassage. So it's a machine that does vibration and massage, and delivered by this really great therapy machine. And the model he used was the Vibmassage Pro. So it's a professional tool that is used mainly by doctors, chiropractors, and such in their offices to provide the vibration and the massage to areas of inflammation. So the thing that's different about the Vibmassage is that rather than like that massage gun that I was using that was like pounding into my hand and my arm and leaving bruises, that the Vibmassage both works the muscle, but it also has a massaging function, which will push in blood flow. And I was actually, like, the areas he was working on was turning beet red. Actually, after a session, my whole face had turned beet red, which was just kind of amazing to me. Like, I remember getting up from the table and he said, "Hey, go look in the mirror." And I did, and like my face was just red. And he said that was because there was a lot of inflammation. I was super, super inflamed, and that was helping push it out. The weirdest thing, though, was when he was using the Vibasage on me, I started getting the craziest case of post-nasal drip ever. Like, if you ever had like a bad cold where you're just like constantly swallowing mucus and stuff, that is exactly how I felt when he was hitting me with the Vibasage. Every time he did it, I would get this crazy post-nasal drip. And he said that was inflammation flushing itself out of my body. And that was just wild that would happen. So, I would feel that, and then it would stop as soon as he stopped. And I would be able to tell him, during the therapy he was doing, oh, I can feel it. And then he'd turn it off, and I'd say, oh, now I can't feel it. So, yeah, he said that there was so much inflammation mobilizing during that it was draining straight through my sinuses. Dr. Stockton said because he only treats very severe cases of inflammation, he's seen this in a lot of patients who get the Vibasage massages. So that was kind of my first initial treatment from him, and he's a very busy guy. He has a lot of people with severe upper body problems coming in to see him all the time. So he could not get me in for a few weeks. So I decided on the way out that I wanted to get the portable Vibasage. So there's two different models of the Vibasage. There's the Vibasage Pro, and then there's the handheld Vibasage. Both of them have the exact same power. It's just the portable Vibasage, it's a smaller machine, and then the Vibasage Pro is a full-sized machine that allows you to have a lot greater control over where you're hitting it. I happen to own both of them. So, but at the time, I grabbed the portable Vibasage on the way out of his office, and he was able to get me one. And I asked him how long it would take for me to get all of this muscle tension and inflammation away from, the thoracic outlet and getting the forearm and all that. And he gave me an estimate on the time. So I got set up with him, and I came in to see him 2 weeks later. I stayed at a hotel nearby and, took the train up again. And he did hours and hours. I am not kidding when I say hours of specific deep tissue treatments to the muscles of my thoracic outlet anatomy. And he did rid my entire thoracic outlet anatomy, the 10 muscles that are on both sides, the bilateral, in about the time that he had estimated, which was a lot of time. I will tell you that. I was there a long time. And by the end of that, he only had enough time to treat my thoracic outlet syndrome. And he said, you need to come back to do the compartment syndrome, which, I knew I had the compartment syndrome because my forearms felt like rocks, and you would stick your thumb in and then it would be like just stuck there for a long time. So I scheduled another time to come back so he could treat the compartment syndrome. So he worked on my forearms when I returned with deep tissue and Vibasage, and he finished at about the time that he estimated again. And at that point, I was feeling a lot better. So I decided that, I wanted to get serious about treating this and reversing it and making sure it never comes back. So, he said, you probably shouldn't do as much gaming as you were doing because that exacerbates it. But I love gaming, so I decided to get the Vibasage Pro that are the model for doctors to use and for cases of very severe inflammation. Knowing that I had that, I decided, let's go ahead and get something that can really, really work on me. And so for the next couple months after I came back, about an hour or so a night, I would use it on myself. Now I will use it a couple times a week, and it's really easy and convenient to use. When you're sitting down watching a TV show or something, you got YouTube on, you can just grab it and throw it on yourself. And I love the size of the applicator pad. I have a larger frame, and it helps, really get on there and flush out the inflammation in the areas of my body. It's soft, and I can feel it penetrating deep into the muscles. And you can even kind of see it, kind of like the effect that it has on your muscles when you throw it on there. It's very comfortable for me to use, and it's very easy for me to treat myself. So, you don't have to wait to use this for someone else. You can do it all yourself. And yeah, I don't need anyone else to come along and help. And the Vibasage Pro especially is very easy for that. I can just hold it and let it go while I'm watching a show. So the pad is elastic and it is able to mold and flex to the contours of your body very easily, which is another key difference from the hard plastic of the massage gun that I was using before. So it just kind of wraps around and easily goes through my body the way that I need it to. It's very helpful when any sort of soreness creeps in. I can get any inflammation out fast before it gets a foothold and becomes a condition that I actually need to see a doctor for again. So, and it's easy to tell that it's working because you can feel a ton of blood flow and heat. It gets very warm and it gets very red. Fresh new blood flows in, oxygen and nutrients flowing into the muscles, and you can really feel it working. It gets very warm and tingly, and it's a good feeling. And I've been recommending the Vibasage to my friends and my family, and I've heard nothing but positive feedback from them. My parents bought their own Vibasage. They use it all the time now. It is great for getting muscles treated which are so key to normal body function. So this is a message to all my gamers out there. My fellow gamers out there, if you're like me and you're hitting your mid-30s and maybe you start getting some hand pain, wrist pain, forearm pain, neck pain, back pain, and it's starting to become a problem, which it will, generally speaking, for most of us, at my worst, I could not play a game, like a PC game, for more than an hour. And when I got done, my hands were in tons of pain. The forearms just hurt so bad. And it got so bad, I would look at my hands and I could actually see them shake. Like that's how much pain it was in. Involuntary shaking. I was just sitting there looking at that. And so like when I started this healing journey, I wondered, like, am I ever going to get to the point where I could even play for have a multi-hour gaming session ever again? And, for severe cases like ours, we go for these 1-hour chiropractor visits, and we go to PT visits, and we get, 15 to 45 minutes of deep tissue a few times a week, and we just don't see progress. So we go to another specialist, like I was doing. I was seeing all these different people. And, my massage therapist guy, he is excellent, but I was in such a severe case that, it needed a severe response. So, when your muscles are severely inflamed and severely contracted without your permission, the brain takes total control, and it just forces that muscle to tense up. It will only release its tenseness on your body with deep tissue and Vibasage, really. And you have to push out the inflammation, and you have to make that muscle relax. And if the area is so inflamed, like my muscles were, you move out a little at a bit, 2 or 3 muscles. And, back when I was visiting Dr. Stockson, a couple muscles took an hour or so of his treatment. It really, really took a lot of time. As soon as you're done, by simple diffusion, the inflammation seeps right back in from the 7 or 8 muscles you didn't treat, and those muscles are soaked with inflammation as well. So, again, you get better for a day because a couple of those muscle points got hit, but you didn't get all of them, so the inflammation just kind of spreads out. That's why you get these severe inflammation problems, like thoracic outlet syndrome, compartment syndrome, and all that. And it requires a powerful vibration and massage tool to move all of this inflammation out of the area. And if your condition is really locked in with inflammation soaking the muscles deep, you might just need something like the Vibasage. Vibasage massage and vibration tool, and 30 hours of deep tissue by Dr. Stockson to get the job done. Here I am 2 years later, and my forearm pain is gone, and I am totally better, and I have this great maintenance schedule, and I'm serious about taking care of my body, which I think all of us gamers should do. And gaming is a relatively new hobby. That is something that is less than 35, 40 years old. And I think we're going to start discovering all sorts of physical problems that gaming can bring about that are treatable and are manageable. So Dr. Stockson helped me by recommending active rehabilitation training. Specifically, he said that I should massage my muscles for 15 to 20 minutes before I work out to get oxygen and nutrients flowing. Then he recommended after a workout session that I massage my muscles for another 15 to 20 minutes to flush out any sort of lactic acid and inflammation that was caused by pumping the muscles. It's just great. It's been 2 years and now I'm healed. I can game for hours and hours and I have no problems anymore. At the time of this recording, the Dead Space remake just came out and I was able to play that all weekend for probably 10 hours combined throughout the whole weekend. Zero problems, no pain at all. I needed that intervention by Dr. Stockson to get the massive amounts of inflammation that was soaking my muscles out. And now it's really the power of the Vibassage that is keeping this condition from coming back. It's a key component to everything that I am doing now. So what I recommend to all my fellow gamers out there in chronic pain, don't give up. And if you are really suffering, you need professional help, and I ask, try to contact Dr. Stockson. If you're looking for a highly effective professional self-massage tool to deal with the aches and pains of working on a computer, gaming, then I recommend you get the Vibassage Pro or the portable Vibassage. And thank you for letting me share my own journey of healing and the story that it took for me to get to the point where I can start gaming again down. And I just thank you guys for listening.